Good morning, ladies and gentlemen. I'm Corporal David Falls, and I'll be your moderator for today's press conference. Bonjour, mesdames et messieurs, et bienvenue. Je suis le caporal David Falls, et je serai votre modérateur. Before we start, I would ask that you turn your cell phones onto silent mode, as well as your Blackberries, pagers, and other electronic devices. Avant de commencer, je vous demanderai d'éteindre vos téléphones cellulaires, téléavertisseurs ou Blackberry, ou de les mettre en mode silencieux. Thank you very much for joining us today as we talk about the dangers of synthetic drugs. Merci d'être parmi nous aujourd'hui pour cette discussion sur les dangers des drogues synthétiques. I would also like to thank our speakers, Member of Parliament from St. Boniface, Shelly Glover, RCMP Deputy Commissioner Mike Cabana, Chief Barry McKnight from the Canadian Association of Chiefs of Police, and co-chair of the Drug Abuse Committee, and lastly, Catherine Spanavello, who comes to us from British Columbia and brings her messages as the mother of a young woman who died after taking ecstasy. J'aimerais aussi remercier nos conférenciers, Madame Shelly Glover, députée de Saint-Boniface, Monsieur Mike Cabana, sous-commissaire de la GRC, le chef de police, Barry McKnight, de l'Association canadienne des chefs de police et coprésident du comité sur l'abus de drogue, et enfin, Madame Catherine Spanavello, qui arrive de la Colombie-Britannique et qui va témoigner en tant que mère d'une jeune femme morte après avoir consommé de l'ecstasy. Following the presentations, we will open the floor to your questions. To help with the questions, we have gathered some subject matter experts. Après les présentations, nous vous donnerons la parole et nous répondrons à vos questions. Pour nous aider à répondre à vos questions, nous avons fait appel à des experts en la matière. We have Luc Chiquan with the RCMP's Synthetic Drug Program, Jocelyn Kula and Benoit Archambault from Health Canada, and Dr. Michael Cheng from the Children's Hospital of Eastern Ontario. Sont donc parmi nous Luc Chiquan du programme de lutte contre les drogues synthétiques de la GRC, Jocelyn Kula et Benoit Archambault de Santé Canada, et de Michael Cheng du Centre hospitalier pour des enfants de l'Est de l'Ontario. Prior to your questions, I would ask that you come to the mic and please identify yourself and your media outlet. Avant de poser une question, je vous prierai de venir au micro, de vous présenter et d'identifier l'organisation que vous représentez. Following that, one of our synthetic drug experts will suit up in the protective gear that is worn when they enter a clandestine lab where illegal drugs are made. The level of protection required will show you just how dangerous these setups can be. Par après, l'un de nos experts en drogues synthétiques enfilera la tenue de protection que l'on porte lorsqu'on entre dans un laboratoire clandestin où sont fabriquées des drogues illégales. Le degré de protection nécessaire vous montrera à quel point ces installations peuvent être dangereuses. After the demonstration, our speakers and subject matter experts will be available for one-on-one interviews. Please let me or my colleagues know if you would like to interview someone. Après la démonstration, nos conférenciers et experts seront disponibles pour vous rencontrer individuellement. Si vous désirez rencontrer l'une de ces personnes, veuillez m'aviser ou en aviser l'un de mes collègues. Now, I'd like to start by inviting Member of Parliament, Shelly Glover, to the podium. Ms. Glover.
Alors, bon matin à tout le monde. Thank you very much, and I'd like to extend a very, very warm welcome to all of you who kindly agreed to join us here this morning. And boy, do I ever feel as if I've got a lot of power behind me all of a sudden. Great. C'est un grand plaisir d'être parmi vous aujourd'hui au nom du ministre Taves, qui est l'honorable ministre de la Sécurité publique. Je suis heureuse de participer à cet événement entouré de tant de personnes qui jouent un rôle du premier plan en aidant le gouvernement à respecter son engagement d'assurer la sécurité des citoyens et de bâtir des collectivités plus sécuritaires pour tous les Canadiens. And I'd like to join with all of my colleagues in extending an especially warm welcome to Catherine Spanavello, whose presence with us today is a testament to the harm and the terrible pain which drugs unfortunately leave in their wake. And I want to thank her as a mother, personally, because you are a courageous woman who may, in fact, save other people's children by being here. So on behalf of all mothers and fathers, thank you for doing this for us. Of course, the minister is thrilled that she's here as well and really sees her as an example of courage that all of us need to demonstrate in taking action to protect our communities and our youth by combating the manufacture, distribution, and the use of illegal drugs. And one of the strongest commitments that our government made to Canadians in the last election, of course, was to continue getting tough on crime, and especially serious gun crimes and crimes involving our organized gangs and drugs. C'est pourquoi le gouvernement a présenté la loi sur la sécurité des rues et des communautés qui vise à alourdir les peines pour la production et le trafic de drogues illicites. Les mesures législatives visent les organisations criminelles qui fournissent des drogues illicites, première source évidemment de financement des gangs et des groupes du crime organisé. Les producteurs et trafiquants de drogue qui menacent la sécurité de nos collectivités seront passibles de sanctions plus rigoureuses. La loi permet de donner suite à l'engagement du gouvernement de tenir les criminels entièrement responsables de leurs actes. And we've taken serious steps to give law enforcement officials the resources that they need to crack down on crime and to help ensure that law-abiding citizens aren't afraid to walk down our streets. We've also taken action to curb the production and use of drugs through the National Anti-Drug Strategy. And we've strengthened the ability of the RCMP to crack down on the sale and distribution of illegal drugs through initiatives such as what we're going to hear about today, the Synthetic Drug Initiative. This allows the RCMP and its federal counterparts to better target their collective resources to combat the production and distribution of illicit drugs such as ecstasy and methamphetamines. Today we know that illegal production and distribution of synthetic drugs in Canada is a growing problem. Nous savons que les drogues synthétiques peuvent causer de graves dommages hépatiques, d'autres problèmes de santé et même la mort. Drugs take away lives. They destroy hope. They ruin the future for countless numbers of young people. So all of us need to take further action to stamp out their production and distribution, and that's why we're committed to doing this with all of our partners. Today's presentation and this press conference underlines the ongoing commitment all of us share to continue tackling drug-related crime, which threatens both our youth and the safety of our families and our communities. It also highlights the wonderful job that the RCMP are doing to keep our communities safe by cracking down on drug trafficking right across this country. Our minister and our prime minister are very, very proud of our members of the RCMP, of our police members across the country. But I want to say a very special thank you to each and every one of them. I am a police officer. I feel as if I am your family and will never forget how hard you work to protect all of us every single day. And know that as a member of Parliament, I am working with the Prime Minister and the Minister to make sure that you do have the tools to do your jobs appropriately. J'aimerais donc vous dire à quel point que je suis fière des résultats que nous avons obtenus jusqu'à présent, des efforts que chaque agent a déployés dans le cadre de l'initiative des drogues synthétiques. And on behalf of the Honourable Vic Taves, I want to extend my heartfelt appreciation to, of course, Deputy Commissioner Mike Cabana and to Chief Barry McKnight behind me from the CACP, and to each of you for the good work that you do. Please continue to do what you're doing. You're making a huge difference, and we believe in what you're doing. So thank you very, very much on behalf of the government.
Good morning, everyone. Merci beaucoup d'être ici aujourd'hui et je voudrais également personnellement remercier Mme Glover pour consacrer de son temps, malgré son horaire très chargé, afin de nous aider à mieux faire connaître cet enjeu des plus sérieux. Beaucoup. J'espère qu'à la suite de cette conférence, vous aurez une meilleure compréhension du fait que nous sommes tous responsables de nous assurer de la sécurité et du bien-être de nos concitoyens. Il n'existe pas un seul organisme, pas un seul gouvernement ou un seul acteur du secteur privé qui puisse seul espérer réduire ou résoudre le problème des drogues de synthèse au pays. Over the past few weeks, several young adults have lost their lives because they used ecstasy. The reports have confirmed that para-methoxy methamphetamine, also known as PMMA, much easier to say, was the common link between each death. I do not want to downplay the impacts of PMMA. However, we want to raise the profile of drug use by calling attention to the fact that even ecstasy that doesn't have PMMA can kill. Bottom line, there is no such thing as a safe batch. Those who consume drugs are jeopardizing their lives every single time they ingest these toxic chemicals. When taking any type of illicit substances, the color, the size, the seller makes absolutely no difference. Our young people need to know the risk they are taking every time they choose to get high. There are too many sons and daughters that are gambling with their lives. Actually, this morning we've put together a display of synthetic drugs. And I invite you, when the press conference here is over, I invite you to have a look at the display. And I guess the question I would ask you is, if you look at all of these pills, if you look at these here, or the ones that are on display, the other ones, can anybody here tell me in which pills there's PMMA? Or even, I guess, more to the point, can anybody tell me which pills are safe to take? I don't think there's any of these substances that are safe. That's the problem. There's no way to know what you're taking and how it will affect your body. These synthetic drugs are being produced and trafficked by organized crime groups. They are putting the lives of law-abiding Canadians, like yourselves, at risk by setting up clandestine labs in both upper scale and lower income neighborhoods. The producers of these drugs, MDMA, ecstasy, methamphetamine, any other type of illicit drugs, are not worried about the safety of their product or about who's taking them. All they care about is money. These groups only need 3 elements to operate a clandestine lab. They need the chemicals, they need the equipment, and they need a location. That's it. Most of the chemicals are available at your hardware store. All of these chemicals are highly toxic and are not made for human consumption, let alone mixing them together. They produce very toxic wastes that are dumped in the environment or simply flushed down the toilet. The chemicals are typically cooked up in disgusting conditions. You can see the montage in the back, and are being sold to our youth as fun drugs. And there's nothing fun about the damage these synthetic drugs cause. As you will hear shortly from Mrs. Penevello, there's nothing fun about burying a loved one. Des criminels font la promotion de ces produits et ciblent délibérément nos jeunes. Ces drogues peuvent être attirantes en raison de leur couleur ou de leur logo amusant. Par contre, elles ne sont pas plus sécuritaires. Nos proches risquent de devenir dépendants, et alors qu'ils pensent s'offrir du bon temps, plusieurs en paient de leur vie. The government of Canada, our law enforcement partners, and numerous organizations and individuals across Canada are engaged in combating the synthetic drug situation in Canada. The RCMP is tackling the problem on many different fronts. First is the National Synthetic Drug Initiative, which was launched in 2008. It is based on 3 pillars of prevention, deterrence, and enforcement. the RCMP's Drug and Organized Crime Awareness Services is spreading the message in communities across Canada through a number of different programs. Second, we are working closely with our domestic and international partners, particularly China and India, to curb the illegal smuggling of precursor chemicals both inside and outside of Canada. Third, we have assigned crime analysts to develop intelligence which is used to lead our investigation. Finally, we have the ChemWatch program, which is working with chemical distributors to educate them about the source chemicals used in the production of illicit synthetic drugs, and we've established a toll-free number for them to report any suspicious activities. Talk to your loved ones about the dangers of taking drugs. Help them understand that every single time they get high, they are risking their lives. In a few minutes, Mrs. Spinavello will share with us how ecstasy use resulted in the tragic loss of her daughter, Erin. Ever since this strategy, Mrs. Spinavello has been educating parents on ecstasy dangers and encouraging them to speak to their children about it. She also teamed up with the RCMP's Drug and Organized Crime Awareness Services to launch the eAware site. For anybody who thinks they are protected from synthetic drug, you need to listen to Catherine Spinavello. We can make a difference, and by getting engaged on the discussion, so can you. Thank you very much.
Good morning, ladies and gentlemen. Bonjour tout le monde. Member of Parliament Shelly Glover, Ms. Spinavello, Deputy Commissioner Cabana, good morning. My name is Barry McKnight. I'm the Chief of Police in Fredericton, New Brunswick, and co-chair of the CACP Drug Abuse Committee. The mandate of the Drug Abuse Committee is to promote safer and healthier communities through proactive leadership by addressing and influencing prevention, enforcement, and the treatment of substance abuse. Prevention and enforcement are the two areas that the police have the greatest ability to influence. In the context of policing illicit drugs, the CACP is primarily concerned with the negative behaviors that arise from substance abuse and the impact of those behaviors on public safety and public order. CACP strongly believes that prevention is most important. If prevention is successful, there will be a decrease in those harms attributed to substance abuse, and we will create safer and healthier communities. The CACP is also committed to enforcement practices that target the criminal infrastructure which supports and perpetuates the cycle of crime, violence, disorder, and victimization of the most vulnerable citizens in our communities. In the context of synthetic drugs, enforcement remains a high priority, targeting those who profit from trafficking, importing, exporting, and the production of illicit drugs. The production of synthetic drugs, as Deputy Commissioner Cabana mentioned, occurs in clandestine labs, and they can be virtually anywhere in any of our communities. Dismantling these drug labs presents real dangers to the police and other emergency services workers on a daily basis across this country. The sole objective of the criminal organization is to make money, and they care nothing about safety in the production or consumption of these drugs. As the Deputy Commissioner pointed out, we all have a shared responsibility in ensuring the safety and well-being of our citizens, of our youth. The police cannot perform our role without community input and support. My call to action today is if you know or if you suspect of a location in your community that's being used to manufacture drugs, or know or suspect that someone is trafficking drugs, I urge you to call the police or Crime Stoppers. The needless deaths from the use of dangerous drugs can be stopped if we all work together. Thank you.
fellow speakers, ladies and gentlemen, panel. I have a unique place here today with all of the officials that have just spoken in appealing to you as a parent to hear a message about educating yourselves and taking the message home and being willing to talk to your kids about drugs before they enter your home or your life. I'm here especially because of my personal tragedy with ecstasy. In 2008, my 21-year-old daughter lost her life, her future, to an overdose of ecstasy. A coroner's report would later state that she slipped into a coma and cardiac arrest and respiratory failure were the cause of death. In 4 years since her death, I've watched with grief and mounting concern as these numbers increase. We're losing more young people as they experiment with these chemical concoctions. I think quite clearly today a national crisis has been recognized, and we have an opportunity to rise to the occasion and join the wonderful team of RCMP and Health Canada and the services that our government is providing us. But accept our role as parents that we must be leaders with our kids. We must be able to talk to them at home before they go out onto the street and hear messages from other sources that may not be as reliable as parental advice. Our kids need constant support to help them with the barrage of media and marketing information that informs an unrealistic lifestyle. If a child of 8 years of age goes out to a ball field with some power drink in their knapsack and learns at that age that they need an enhanced drink in order to get through a baseball practice, then what could we possibly expect they're going to think at the age of 18, 19, or 21 that they need to enhance their weekend experience? There's subtle messages that we're sending every day to our children by allowing chemical additives to come into their life at an early age and stage. There is accurate and educational information available on both the RCMP and Health Canada websites, and I urge you to search out that information and inform yourselves. I urge you to take an advocacy role in your children's life and open the conversation at home. Your kids are dealing with these issues already, whether you've recognized it or not. Be a balancing voice in their life and give them a chance to know enough about these chemicals that they can say no when they're offered them on a weekend or a weeknight event. We must be brutally honest about the poisonous toxicity of these chemicals. They're being packaged in pretty pills with happy faces. They're easily available, they're affordable, and they are attractive to this young youth culture. The truth of the matter is, these drugs are produced by criminals who have absolutely no regard for public safety. They have no accountability, and the only incentive they have to continue producing these drugs is a financial return on their investment. Let's work to stop this cycle. Educate yourselves to be conversant, to be able to bring this conversation up at home. Encourage your government to enact policies that support, policies and legislation that support our enforcement officers in going out into the field and having to deal with these criminals. Last year, there was a powerful amendment made to Bill C-475 that now enables police to arrest individuals for possession of the precursors to making ecstasy and meth. This is a powerful tool. This helps keep the drugs off the street before they get to our kids. You'll think, after hearing some of these comments, that we compared notes and that we had a conference before this press release this morning, but in fact, most of us only met for the first time this morning. My message is this, ladies and gentlemen: there is no safe amount and there is no safe dosage, and you must talk to your children about these drugs. You need to raise this conversation in your household. In closing, I'd like to say, please do this before the agony of ecstasy becomes a part of your life or takes the life of someone you know. My family supports us telling this story in public because we feel that by sharing our story with you, you'll be able to take something home to your house and open this conversation with your children. Thank you for your time.
Thank you very much for sharing your personal tragedy with us. And now, before I open the floor to questions, I would simply like our subject matter experts at the table to introduce themselves and let everybody know about their expertise. Merci beaucoup. Avant de passer à la période des questions, j'aimerais que nos experts viennent se présenter et qu'ils vous parlent un peu de leur expertise.
My name is Michael Chang. I'm a child psychiatrist at the Children's Hospital of Eastern Ontario and the Ontario Centre of Excellence for Child and Youth Mental Health. And I regularly deal with children, youth, and families who are affected by drug use.
Bonjour, je suis Benoît Chambault, je suis gestionnaire laboratoire du service d'analyse des drogues de Santé Canada. So I'm Benoît Chambault, lab manager of Drug Analysis Service in Health Canada, and I'm here today to answer your question concerning drug analysis and results.
My name is Jocelyn Kula. I'm the manager of the Regulatory Policy Division with the Office of Controlled Substances at Health Canada, and I can answer questions on the regulatory framework for controlled drugs and substances.
Good morning. I'm Corporal Luc Chicoine. Bonjour. Je suis le caporal Luc Chicoine avec la GRC. Member of the RCMP, I've attended over 100 clan labs during my service, and can answer anything about, or most of the thing about production and trafficking of such substances. Luc Chicoine de la GRC, encore une fois, j'ai démantelé et enquêté au-dessus de 100 laboratoires clandestins dans mon service avec la GRC, et je serai en position de répondre à vos questions en relation au produit lui-même ou à la production.
Thank you, merci. I'll now open the floor for questions. I'll just remind you to please go to the mic and ask a question. Je vous donne maintenant la parole pour la période de questions. N'oubliez pas de vous présenter au micro avant de poser une question.
Hi, Mike Lucouture from Global National. I'm not sure which member of the RCMP or if it'd be Chief McKnight who can answer this. How hard is it to keep up with these criminal organizations that are making these drug labs? I mean, you guys started an initiative in 2008. Sort of want to know where we are right now and the difficulty that law enforcement has found in trying to keep up with this.
Thank you very much for the question. It's like any activity that organized crime is involved in. They're very adaptive, and they change their practice. If you look, though, at the track record and all of the initiatives that have been implemented, starting with the synthetic drug strategy that was announced back in 2008, and some of the efforts around that, it has had an impact. And you look at some of the seizures of precursor chemicals that have occurred in recent years. Actually, very recently, I think it was on Monday, there was a press conference in Toronto in relation to a sizable seizure. So we are having some success, but as I said at the beginning, they're very adaptive and they move on to different types of chemicals.
Just as a follow-up, in terms of illicit drugs that you're facing on the street right now, is this the worst and the toughest one for you guys to track and keep up with? I mean, just give me an idea of, are synthetic drugs the biggest thorn in the RCMP side?
May not necessarily be the biggest thorn in the RCMP side, as you put it, but it's a drug and an activity that is actually having a significant impact on our communities, on our youth, and our population. You look at the recent deaths in British Columbia, in Alberta, I think they're quite indicative of the dangers that are associated with their use. Go back to, I believe it was in 2011, there was 18 deaths associated to ecstasy alone in British Columbia. And I'd like to point out that only 5 of those actually had a link to PMMA being present in the ecstasy. So as I said at the beginning, it's not about PMMA, it's about synthetic drugs.
So it's an increase then? I mean, is it a dramatic increase in what you're seeing here with deaths related to synthetic drugs?
I don't know the statistics. I'm afraid I can't answer whether statistically there's been an increase in deaths, but from our perspective, the impact that it's having on our communities, action needs to be taken. That's why in 2008, with the assistance of our domestic partners, our governmental partners, and internationally with some of the law enforcement agencies around the world, we changed and put focus on the issue.
Hi, Danielle Bell with the Ottawa Sun. I'm just wondering if we've more what the situation is a bit locally here in Ottawa. Specifically, have we seen PMMA here? Are we expecting it to come here?
I don't know whether, look, I can tell you, and without having the specific on the situation with PMMA itself, I can tell you that ecstasy, synthetic drugs, are very much present in Ottawa. It's present in every community across the country.
I was also just wondering a little bit about what you're seeing at CHEO in terms of young people that are coming in, drug overdoses or anything like that.
CHEO actually has seen a surge in demand for services for various mental health related issues such as mood, depression, anxiety, suicide, which includes drug use, over the past year or so. And we believe there's probably many complicated reasons. And as a clinician, I'm increasingly getting more and more frustrated at having to deal with this problem. We can help one family at a time doing treatment and therapy, but we're beginning to realize we have to start looking at the underlying social causes for these issues that we're seeing. I echo many of the statements that my colleagues have made. Barry with CACP, Madame Spavinello. We live in a culture that teaches our kids that drugs are acceptable. And I have to admit, my field of medicine also teaches that. You know, if you have a cold, or sorry, not a cold, but if you have an infection, take a drug. If you can't focus, take a drug. And our kids are learning this message. They're also learning this message from the media. Our kids are learning that in their drug acceptable culture, in their movies, television shows, and their heroes, that drugs are acceptable. And not only that, even if you're the best parent in the world and you're spending time with your kid, the problem is that our kids are learning a message that their peers are more important than the adults. And so our kids in today's society are learning that parents are lame and that friends and peers are the most important thing in the world. And all of these factors are contributing to this epidemic that we are seeing in child and youth mental health and drug abuse problems. So I think my call to action would be, as a society, we really have to look at every aspect of society, and we all have to work together in order to make Canada a more family, parent-friendly place.
My question is for MP Glover. There's been a number of experts that have come out. For instance, you mentioned the government's crime legislation during your talk. A number of experts have said that if this legislation passes, then, for instance, if teenagers are passing ecstasy to one another, or any other drug for that matter, they can be charged with trafficking. I guess my first question is that in fact true if this legislation does pass? I'm referring to Bill C-10. Would that be true?
Bill C-10 is actually designed to target the traffickers that are doing this. I mean, you see before you the results of a lax system, a judicial system that was not able to deal with the folks who are trafficking this kind of stuff. But it's also designed to make sure that there's a deterrent factor, which affects all of us, which affects our youth. Because unfortunately, many of the people who are creating these types of synthetic drugs are mentoring some of our youth to then become traffickers. And that has got to stop. We've got to nip that in the bud. And this bill is a good step forward, but we have much, much more to do to support our law enforcement officers. And I have to admit, many people don't realize the Conservative caucus is made up of many, many different diverse backgrounds. We have 13 police officers in the Conservative caucus. 13. There isn't a single police officer in any other caucus in Parliament. So we have the benefit of people who've actually lived in the police law enforcement community, and we're standing shoulder to shoulder with the folks here today, the RCMP. People who've actually lived in the police law enforcement community, and we're standing shoulder to shoulder with the folks here today, the RCMP, Chief McKnight, and police officers across the country to say enough is enough. We need to protect moms like Mrs. Spanavello. We need to protect all of our children from this kind of garbage.
Right. Okay, I understand that. I guess it's kind of a yes or no answer, though. Is that in fact true? Well,
just on that
sure, but first I'd like to get an answer to my question from MP Glover, if I could.
If you want to repeat the question, because you had a couple of different elements in it, but go ahead, Chief McKnight,
Well,
if you want.
once Bill C-10 passes, if you're a 20-year-old who passes ecstasy to someone else with no money exchanged, can you be charged with trafficking?
Well, first and foremost, you can't just blanket say, well, yes or no, because every case may have some different factors involved. For example, the child may not know that it's ecstasy. They may think it's a Pez candy, because quite frankly, many of them look like candy. So I can't give you a yes or no answer based on a hypothetical, but what I can tell you is that traffickers will go to jail under that bill, and it's high time they did.
Thank you very much for that, Ms. Glover. We'd like to end today by demonstrating the process by which Clan Lab members go through prior to entering a Clan Lab to protect themselves from the hazards found in a Clan Lab. Pour terminer, voici une démonstration des étapes que doivent suivre les membres de l'équipe des laboratoires clandestins avant de pénétrer dans un laboratoire clandestin afin de se protéger contre les dangers qui recèlent ce genre de laboratoire.
Is that really the end of question period? You've had 3
Oh, I
questions.
apologize. I didn't see you standing there. Please go ahead.
There are no other journalists who want to ask questions? So,
By all means, go ahead.
okay, I wanted to understand a little bit more in terms of police enforcement issues. If Amanda Pfefferin with CBC, what are the chemicals that we're trying to stop and go after? What are the raw chemicals that are creating the issues and that we want to target?
Okay, excellent question. I don't want to get into that field because there's so many, first of all, I can't even pronounce the names of some of those chemicals. So I'll pass that over to Corporal Chicoine.
Most of the chemicals that we encounter in those labs are fairly common to day-to-day use in domestic application and industrial applications. It's very difficult to put legislation in place in order to control everything that's there. Our life would be miserable. We're looking at paint thinner, for example, which I probably have in my garage. Probably have most of the chemicals to cook methamphetamine or MDMA in my garage because they're that normal usage. In muriatic acid, in, like I was saying, paint thinner, toluene, acetone, those kind of chemicals. Certain chemicals are regulated already under the precursor legislation, under the Controlled Drug and Substances Act. But overall, the legislation, I don't believe, will bring more regulation to the chemicals that we see in those labs.
In terms of the making of methamphetamines, for instance, are there pharmaceutical drugs that are being targeted particularly that are available just over the counter?
Over-the-counter drugs, cold medication that will have active ingredient as pseudoephedrine or ephedrine is the most common one that we've seen. In Western Canada, we've seen a large influx of the seizure of those tablets in our methamphetamine labs. As far as I know, it's not tabled here in Canada to further the legislation on that product. It's been done in the States. Actually, I believe there's 2 or 3 states right now that the ephedrine is not over the counter but needs prescription.
And is this a very effective way of going at it? Has the pharmaceutical industry been lobbying against it? What's the situation with that?
I couldn't tell you. I couldn't update you on that at all. So.
If I may, I'd like to jump in here. Excellent questions, but I think actually the point of the discussions we're trying to have here today is specifically sort of a signal that enforcement alone is not the answer to this problem. Regulating the chemical industry is only one part of the problem because as I mentioned earlier, criminal organizations are very adaptive. So if we regulate one chemical, they come up with a different chemical that they can use. The solution to the problem and the wake-up call that Mrs. Spinavello spoke about is the fact that it's a global response that we need. Law enforcement alone cannot do it. Parents have to get involved. The communities have to get involved. Governments at the different levels have to get involved to resolve that issue.
Yeah, sorry, that was my only, I cut you off and I didn't give you a chance to respond.
Excuse me. Yeah, I'm all choked up. I got a bit of a cold. Yeah, I just wanted to add something to what Mike was just mentioning. The unified approach is where one of the early questions was about what measure of success are we having. We will always be limited if we don't have a unified and comprehensive approach across all of the components. Enforcement alone, we will not arrest our way out of this problem, but each component must be addressed, and the more we see that, the more success that we'll have.
And sorry, you'd mentioned you wanted to say something in response to my earlier question.
Yeah, just a quick point about the discussion that sometimes we hear around whether or not some sections of the criminal code, if they were applied in a very rigorous and technical fashion, could have an absurd result. Although we have to have debate and discussion around all of those issues, if the discussion is just theoretical, I can tell you, you can take any section of the criminal code, you can deconstruct it to the basic elements, and if it's just a theoretical discussion, you can contrive a circumstance that could have an absurd result. But as police officers on the street can tell you, that passing of the pill from one person to another, that is not what we're focused on. That is not what we're dealing with, and there are checks and balances in the system that deal with that. So it's a good question, and we do hear that, those circumstances from time to time when that question's asked.
Are there,
Would it be okay if I made a point to echo some of what my colleagues are saying? I feel a deep sympathy for the police because here we are, we're growing up in a society where kids learn that drug use is acceptable from an early age. Kids learn from all the television shows, the media, the things they watch. They learn that, you know, your parents are lame and stupid. I'm just going to do what my friends do. They learn that their heroes are using drugs. They learn that it's cool to use drugs. So it's no surprise many of them use drugs. And then I have a deep sympathy for the police because here you are trying to solve a problem that you did not create at all. What we really need is we need to wake up as a society and look at every single influence that our kids are exposed to from birth because it all contributes to this problem. You know, for the parents of the young children there, you know, my colleague here has talked about how it's important for parents to talk with their kids. Well, we live in a society that makes it really hard for parents to talk to their kids. You know, from an early age, our kids go into daycare all day. Even simple things like shorter work hours, even simple things like on-site daycare would add a lot to building those deep relationships that kids need so that when they're older, they will be more closely attached so that they will more likely listen to their parents. Even simple things, well, maybe not so simple, but the media. You watch any show, you know, whether your kids are watching iCarly, Dora the Explorer, Modern Family, Big Bang Theory, the theme of all these shows is the same. You don't need parents. Your friends are the most important thing. So it's no surprise that by the time our kids get to be teens, they're embarrassed to be near their parents. All they want to do is spend time with their friends. And for those of you who are parents out there, have you noticed that when your kids get home, all they want to do is go on Facebook and MSN with their friends? And that is telling you that you've lost touch of your kids. Your kids care more about what their peers think and more about what their unhealthy values are of their peers. So as a society, we need to make massive changes or it's going to be too late and we're going to lose our kids. And if you think things like BC, I know people have looked at the BC riots and they've said, oh, it's the police's fault. But no, it's a symptom of a wider problem in our society. We have a whole generation that's growing up that has no respect for authority, that does not care what their parents think, that only cares about what their peers think. So this is a good time to wake up and start making some serious changes. Thank you.
thank you.
Yes, class, thank you.
Are there any additional questions from the floor at this time? Or any additional last-minute comments from the panel? Perfect, thank you very much. So we will now move on to a demonstration of the